Okay, good morning, everybody. I am Christopher Thurman. I go by Chuck. I'm an Associate Dean of Clinical Education here at the school, current Chief of Staff at OSU Medical Center. But my tie-in to this topic is I'm the Clinical Learning Environment Review Professionalism Subcommittee Chair. And I'm so excited to introduce for you Attorney Callahan. Our speaker our program is underwritten by an educational grant through OSU Medical Center, Graduate Medical Education. A disclosure statement has been signed and is on file in the Graduate Medical Education office. Karen is one of only 4 women in the state of Oklahoma who is a fellow in the American College of Trial Lawyers. She has been defending healthcare providers for over 30 years. She is also one of several members of the firm with a multi-state practice and has considerable experience trying cases involving catastrophic injury. Karen is also a nationally recognized expert on medical staff issues, particularly with regard to credentialing. She has acted as counsel for the medical staff on multiple fair hearings and has acted as a hearing officer for fair hearings. She has presented countless seminars to healthcare systems and medical staffs throughout the country on credentialing and other medical staff matters. In such, Karen is widely regarded as, in Oklahoma, as an expert on peer review and patient morbidity and mortality review. She has also published continuing legal education materials on the topics of defending medical malpractice cases and EMTALA. Please, this morning, help me give a good welcome to Attorney Karen Callahan.
Thank you, Dr. Thurman. I appreciate that introduction. Good morning, everybody. I thank you for the opportunity to be with you this morning. I have to confess, lawyers, we still do everything in person. So I'm used to standing and walking around a room and being somewhat animated and talking. And so sitting in front of a computer screen, not being able to see my audience is a little odd. So forgive me if it takes just a minute to get my sea legs here. You know, when I first started practicing 30 years ago, professionalism was known, but it wasn't something that was really talked about very much in the field of medicine. Mostly the emphasis was on competency, on excellent training and skill set and the use of appropriate judgment. And it's really only been more perhaps in the last 10 years that there has been an incredible emphasis placed on professionalism. And we're now at a point where professionalism is equally important with competency. So I think this is a really important topic, and it's a topic that really starts now in your training program, and it will continue throughout your medical staff career. So the screen is frozen. Let me see here. Voila, good, thank you. Okay, so just briefly, what is a professional, and what do I mean when I say professionalism? You know, not everybody that has a job is a professional. There's a difference between those of us in a profession and people that work in a business. I'm a professional, you are professionals, accountants are professionals, and it means that we have a relationship with our clientele or your patient relationships that's in law called a fiduciary relationship. It's one that is built on confidence and trust. If your patients don't have confidence in your skill set and they don't trust you, they're not likely going to continue care with you. And the same is true of my clientele. If they don't trust me to represent their interests in litigation and to do my dead level best for them in the courtroom, they're probably not going to continue to allow me to represent them. Professionals are people that are bound by a code of ethics. I have a very extensive professional code of ethics that governs my conduct day to day. And within the medical profession, you are governed by a code of ethics as well. And so when we say we're professionals, what we're saying is that we're making a declaration to anyone and everyone that's listening that we're going to act in a certain way. We know that we're expected to act in a certain way, that we have duties to comply with, and that if we don't do that, we are subject to discipline. You know, if the waitress doesn't fill my cup of coffee quickly enough or doesn't clean my table right, there's no disciplinary action at a professional level. But if I don't do my job right, and if you don't do your job right, we're subject to disciplinary action by our licensure boards. You are going to be seeking privileges to practice in hospitals when you get out of training and out of fellowship. Some of you may already have those kinds of relationships through moonlighting activities. And if you don't meet those professional obligations, then you won't continue to maintain privileges at those hospitals. And the same is true with your professional associations, your certifying boards. I can honestly tell you that in the last 10 years, I can think of 4 or 5 specialty physicians who have been stripped of their board certification because of their lack of integrity, their lack of honesty, and investigations that their boards did into complaints related to unprofessionalism that seriously impacted their ability to move forward in their profession. So I wanted to just briefly touch on the 6 areas of general competencies. I know that these are areas that each of you are familiar with. They are the ACGME core competencies. And if you look at these, they're fairly equally divided between competency in your skill, reason, judgment, and competency in your professionalism. Practice-based learning and improvement is one we're going to talk about in some other slides, where when you're a professional, you have a commitment to lifelong learning. You have a commitment to always improve and learn as you go. I mean, I've been practicing 31 years and I still haven't learned everything. And I learn with each case and with each trial, and I hone my skill set. And that's something that as professionals, we're called to do. Interpersonal and communication skills. It's important that professionals are able to communicate with their clientele at a level that their clientele can understand, and that we do so in a way that is respectful. And all of that is tied up into this professionalism. So what really are some of the obligations and values of professionals? These are some things that sort of set us apart from people that are in jobs that are not necessarily professions. So we're called to be altruistic. We're to put the interest of our clients over ourselves. You know, my happy place is in a courtroom, and that's not the happy place for my physicians. But that's where I love to be. I love talking to juries, and I love putting on evidence, and I love proving that my physicians met the standard of care, and that if there was an adverse injury to a patient, that it wasn't because the physician did something wrong. It is because there are just certain things about medicine or people's bodies that are not perfect, but it wasn't the result of negligence. And that's where I love to be. And there are a lot of challenging cases that I would have loved to take into trial. But when I did the risk-benefit analysis with my client, and we looked at extraneous issues in the case, it was really in my client's best interest not to take the case to trial. And so my job was to put their interest over mine. Accountability. This is something that we hear about more and more in society, is people that are not accountable for their actions. Well, as professionals, we're called to be accountable. You're accountable to your patients. In the middle of this public health crisis, we're accountable to society and to your profession at large. We're human beings, so we're going to make mistakes. We are not perfect, and you're going to try your dead level best on something, or the team of providers that you're working with are going to do their very best, and yet somebody might make a mistake. And the important thing is to have that integrity, have that accountability, and know how to communicate those mistakes and move through those issues with your patients or with your patient care team. As I said on the last slide, we're called to a lifelong learning experience. So we have that commitment to excellence. We also have duties to be available when our patients need us, duties to be responsive to our peers and our patient care team. Physicians, as you well know, you guys live by pages and phone calls and texts. And when you're on staff at a hospital, you have on-call responsibilities. And so your time is constantly in demand. And it's knowing how to balance those things and be able to be timely in your responses. There are several studies that show a direct correlation between professionalism and conduct and quality or poor quality patient care. Over the many years I've been doing this and meeting with nurses and preparing cases, I can't tell you the number of times that I've talked with nurses about why a particular issue that developed with a patient wasn't brought to the physician's attention at 3 o'clock in the morning, or wasn't brought to a physician's attention sooner. And time and again, I would hear, well, this physician has told me never to call him at night, or we've learned if you call him after 1 o'clock in the morning, we just get yelled at and then we get into trouble. And so it's an intimidating environment that could lead to really important information that needs to be brought to your attention by your healthcare team, not getting to your attention in a timely manner because they fear some retribution or some demeaning or disruptive conduct that makes them hesitant to carry out their responsibilities. We have an obligation to have integrity, to be fair and truthful with the people that we work with, as well as with our patients and their family members. We have an obligation to be respectful, and that's respectful to everybody in our food chain. I'm a partner in a law firm, so some would say I'm at the highest point of the food chain in my law firm. But I tell people when I hire them, if you don't treat the runner or the file clerk with the same respect that you treat me, then I have no need for you in my employment. And I mean that sincerely, because we have to have respect for one another at a professional level in order for everybody to pull together and work on the same team. You guys live and breathe in an electronic medical record, probably more so than you'd like to. And respectful documentation is exceedingly important. I still see providers that use the medical record as a mechanism to vent on one another, or to throw somebody under the bus, or to point the finger at somebody else for not doing something that may have led to an adverse outcome. And that's not the purpose of the medical record, and that's not considered respectful documentation. So respect in all aspects of our communication, and respecting confidentiality. not having conversations about PHI on an elevator where the public or others who are not involved in that patient's healthcare teamwork would be able to access that confidential information. And then certainly, as a professional, it is your job to be a patient advocate. Again, we're all human and we all have personal biases that are inherent in us. But as professionals, we have to learn how to separate those personal biases from our role as professionals. So some behavior that's expected of us, and it flows in many respects with the last slide and some of the things that we've talked about, but empathy, if you think about it, you are in this profession because you care about other people. You want to do things to make them better, to make their lives better, to improve their health and the quality of their life. And so showing compassion in an appropriate way, helping them in a difficult situation with their healthcare and being supportive and reassuring. People go through difficult times and it's okay to say, I'm sorry. I still run into a lot of physicians that are afraid if they say, I'm sorry, it's somehow an admission of guilt or an admission of wrongdoing. Saying you're sorry for something that somebody is going through is just an expression of empathy. It in no way implicates that anybody did anything wrong. Our communication is really important. You know, I spend time with my doctors when we're getting ready for trial, and I tell them, you have to understand that the group of people we're talking to on this jury, on average, have maybe an 8th grade education. Now, that might be a little bit of an exaggeration, but we don't have bankers and investors. We have people up there that may have a GED. And so we have to figure out a way to communicate in a way that they understand us. You guys speak a very unique language in medicine, and when you communicate with one another, you know what you're talking about. But when you use high-tech medical terminology with patients or with patients' family members, they might not be able to understand that, and they might be intimidated by it and feel like they can't ask questions, and that can be an impairment to the professional relationship that you want to have with those patients. So as professionals, we have to learn how to adjust our communication to our audience. We don't want to talk down to them. We don't want to belittle them. But we need to kind of understand where they're coming from and make sure that we're not talking above them either. Communication is something that's exceedingly important when there's been an adverse outcome. And again, when I say adverse outcome, I don't mean as the result of somebody doing something wrong. It's just, we're going to have adverse outcomes because nothing about medicine is perfect and nothing about the patients that come to see you is perfect. So being able to help somebody understand why they didn't have the outcome that you were hoping that they would have, and things that may have contributed to that, and what can be done as a result of that, are important communication pieces. I can think of 3 or 4 physicians over the course of my career that have had 15 or more lawsuits. And the common theme running through those lawsuits has been, when I talk to those patients in a deposition and I ask, why did you sue Dr. So-and-so? It's, you know what, after the complication I developed, I never saw him again. He never came back. Other people came and talked to me, but he never came back and talked to me. And so I felt like he was hiding something. So communication is very important for, even after that adverse outcome, to continue that trusting relationship. Time management is huge. If you're a surgeon and you are constantly late to the OR and it throws off all of the cases for your OR, your team, your anesthesiologist, that leads to complications in managing the OR and leads to a lot of other complaints and resentment, and it is adverse to trying to develop a team of people that can cohesively work together. Completing tasks in a timely manner. Some of you will be Dr. Thurmans, you will be chiefs of staff, you will be chairs of credentialing departments, and you are going to have even more responsibilities in those roles than just taking care of your patients. And so being able to keep the ball moving is very important. And timely documentation. Again, one of the things I hate to see most when I start looking at a medical record in a new case is that the discharge summary was signed off on 6 months after the patient died, because we're going to have some explaining to do over why that was. We as professionals are to be self-motivated, and most of the time we are self-motivated. That's part of what makes us thrive as professionals. But it's our job to take initiative, to always look for ways to improve ourselves, to appropriately correct behavior of other people that are on our team, and to constantly take advantage of opportunities to learn. I think it goes without saying that we'd all rather be with people that are neat, clean, and well-groomed than people that smell bad and look like bums. So appearance is important to professionalism. And self-confidence is another value. And I don't mean self-confidence in that we should think so highly of ourselves that we think we're the best at whatever it is and we put ourselves above others, but being able to exercise good judgment, trust the judgment that we're exercising, knowing our own strengths and weaknesses, because we all have them. I have weaknesses and you have weaknesses. And when I am working with my trial team, I'm looking at other members of my team that have strengths that might not be my strengths, and how can I use their strengths along with mine to put together the best case we can for our client physician. And then teamwork and diplomacy is really important. A fractured team does not work well together, and a fractured team will more often than not lead to less quality patient care. And so certainly a team environment is the best way to approach problems as well as successes. So this is something we probably, each learned in kindergarten, is that honesty is the best policy. And I touched on this a little bit. We have to have accountability as professionals and be willing to take that responsibility when an error is made. There's a health system that I work with that has a really, I think, neat philosophy. It's called communicate openly and respond early. And they have a mechanism in place whereby if there is an adverse patient outcome, it is investigated. And if it's determined to be the result of physician error or nursing error or some other type of error within the healthcare environment, they work together as a team, the nursing leadership, the physician involved in the care team, any other members of the team that were integral to the event that occurred. And they reach out to the patient or the patient's family and say, we would like to sit down with you and actively talk with you about your care and what happened and why you're having to deal with the issue that you're having to deal with. And we do that. We spend about an hour or hour and a half, and we don't wait for the patient to file a complaint. or the family to file a complaint, we take that ownership up front, and we help them understand what we've learned from the event and what we've done to hopefully prevent it from happening again. Patients don't like when something bad has happened to them, but they all like to know that if whatever happened to them is something that can be fixed, that we're going to fix it. And then we work with them to try to make that right, whatever that might be. Covering up a mistake is the last thing that you want to do. It will lead to nothing but complication. Disciplinary action at the hospital, disciplinary at a licensure board level. The matter will likely end up in litigation. And covering up a mistake is intentional conduct. Intentional conduct is not covered by your professional liability insurance policy. And if a jury finds intentional conduct, and let's say they award $1 million for compensatory damages that are covered by the insurance policy, but they're really angry about this intentional conduct, and they award $2 million in punitive damages, those punitive damages come out of your own pocket. And so this is something that I will say we see more and more of in litigation, and that is an investigation to determine if there's been a cover-up. And it's done through the electronic record audit trail. In every case I have now, we produce an audit trail, and the other side hires forensic experts to go through the audit trail and try and find things that would suggest some type of a cover-up. I had a case just in the last couple of years where a physician or a patient declined substantially as a result of not timely getting a medication. And the physician was insistent that he had given the order and the nurse had just disregarded the order. And if you just looked at the record on paper, which is how we get an electronic record, it looked like there was an order and that there was a delay between when the order was put in the chart and when the nurse gave the medication, and that it very well may have been that delay that led to the decompensation. Once the audit trail came about, we were able to see in the audit trail that the physician actually didn't give the order until well after it was about 6 hours after the patient had coded and gone to the ICU, and he went into the record and retimed the order to make it appear as though he had given the order well in advance of the event. It wasn't too hard to figure out with the audit trail because it is a footprint of every time you open up that record and where you go in that record. So it wasn't a very good job of a cover-up, but that physician is no longer on staff at that hospital. His integrity and his lack of honesty was a real problem for that medical staff. And he is currently in the midst of a licensure board action regarding the same thing and is not actively practicing at the moment. So professionalism can certainly have an adverse impact on your career if you are unprofessional. So these disciplinary actions, litigation involving cover-up, all of these things can lead to what's called a National Practitioner Data Bank report. We could spend 2 hours just talking about NPDB reports, but basically it is a data bank of adverse actions, license report actions, hospital privileging actions, judgments in litigation, settlements in litigation, that all hospitals, all healthcare insurance companies that you're on panels of licensure boards have a duty to query to get background information on your conduct and competency. And it's not it's not something that you want to be in if you can avoid it. So now, how does all of this professionalism really impact your future? And that is what I mean by when you complete your training and you complete your fellowship and you're now at a place where you are a full-fledged member of a medical staff, you go through this credentialing and privileging process. What are they really looking at to see if you are the type of physician that they want on their staff? So the credentialing process can take a couple of months. It's a process where you fill out a 13, 14, sometimes 20-page application that is exhaustive of everywhere you went to medical school, everywhere you've trained, everywhere you've been on staff, peers that you've worked with, names of your trainers, insurance companies that have insured you, all sorts of things that relate to your professional practice. And that facility is going to go through and look at that professional experience, and they're going to double check things. They're not going to take anything really that you say at face value. They're going to go through and make sure that you've done all the things that you've done. Because if they put somebody on staff that hasn't done those things, bad things happen. I had a case out in West Virginia. Gosh, it's been almost 13, 14 years ago. But we had one physician who professed to be an orthopedic surgeon, and he produced a letter from a trainer saying that he had completed his program. A headhunter had helped this hospital find him, and it was a very small hospital, and they were desperate for this orthopedic surgeon, and they didn't really do a very good vetting process. And after he'd been on staff about 6 months and they'd had a number of injuries, some lawyers got together and filed 124 lawsuits against this hospital and this healthcare provider. And when the lawyers got involved and we started looking at this credentialing, this vetting process, we found that the hospital really didn't do a very good job of double checking this physician's background. And he was not an orthopedic surgeon. He was not anything. He had completed medical school. He had completed 2 years of an orthopedic surgery program before he'd been kicked out. He had completed 1 year of an anesthesia program before he had been kicked out. He claimed he had done some OB-GYN rotations, and therefore he was capable of delivering babies, not so much. He did a year of podiatry. He dabbled, but he actually didn't complete a single training program. And so if the hospital had done the vetting process they should have, he would have never been put on staff. And of course, there were a number of things about this physician that were unprofessional. In the end, he lost everything, and he's in the midst of a fairly significant FBI investigation right now for all sorts of fraud and cover-up. So suffice it to say, once again, professionalism and professional conduct is exceedingly important to a successful career. So when you get on a medical staff, there are a number of documents that will govern your behavior and govern your professionalism. There are medical staff bylaws, medical staff rules and regulations. There's a code of conduct, and there are a number of policies and procedures, and they're going to vary from hospital to hospital. And sometimes there's this belief that, well, policies and procedures really only apply to nurses. They don't apply to the medical staff, but there are a number of policies and procedures that do apply to the medical staff. An example I would give you is the timeout procedure for surgery. Every hospital has a timeout procedure, and it requires the surgeon who is the captain of that ship to participate in that procedure or in that timeout. And several years back, I worked with a hospital that had difficulty for whatever reason in one particular surgical specialty getting those surgeons to participate in the timeout. They would tell nurses, well, just document that I'm there. And after a while, it came out that the nurses were documenting things that weren't appropriate because the physicians told them to. And the nurses were too afraid to say, I can't do that, or, you need to be there, or anything like that. So the way the hospital handled it was to say, if you're found to not participate as you should in a timeout procedure, you'll be suspended from surgery for 30 days. Now, if you're a surgeon and that's your livelihood and you can't perform surgery for 30 days, that's a problem. If they had said you're not going to be able to perform surgery for 31 days, that's an adverse action that would be placed in your data bank report for the rest of your career. So knowing the policies and procedures and complying with those is part of professionalism. You're going to be credentialed by third-party HMOs and PPOs. So it's going to be important to your success that you are able to provide care to patients that are part of Aetna and Blue Cross Blue Shield and Humana and so on and so forth. And they're also going to be doing this vetting process and looking at your professionalism and your conduct, as well as your competency. I'm working with a hospital right now that has adversely had to discipline a physician for anger management issues in the OR. And it's an adverse action that led to a data bank report. And when that physician came up for reappointment at some of these HMO, PPO organizations, they pulled the data bank report and they saw that there was something new in there since the last time that they had credentialed this physician. And the last I heard, he's now been dropped from 2 large programs, and he's in the middle of a battle with a third one who is threatening to drop him as well. And being credentialed by those organizations is important to your body of clientele and the patients that you serve. So again, it's not just about the competency. It's not just about the skill set and good, reasonable medical judgment, but it's about the respect, the timeliness, the teamwork, the accountability, and all of those things that go along with professionalism. So we talked about in that credentialing process, there's this application. And there are questions that you'll be asked about your behavior and your education and your training, but you're also going to sign a document that allows that hospital to reach out to anybody that's been in your training program, anybody that's on staff at any hospital where you've been on staff, and communicate with them about your ethics, your moral character, your ability to play well with others. Are your peers, do you respect your peers, and are you somebody that they like to work with? So any misstatements or omissions that you make on the application can certainly lead to adversity in your relationship with those facilities. They're going to ask very specific questions of your trainers regarding professional conduct and medical ethics. They're going to send letters to every hospital at which you've been on staff, asking about that same information. And these letters most of them are pre-printed, and they have categories along the side with boxes to check for poor, marginal, average, good, and outstanding. And I've seen these letters in files where, when asked, what is their technical skill set? What is their medical judgment? There's a checkbox next to outstanding. But when it comes over to what are their relationships like with the nursing staff? Well, is their documentation timely? Do they have good interpersonal skills? Are they respected members of the medical staff? Then the check boxes are in poor and marginal and average. And those are letters that raise what we call red flags. Those are letters that cause medical staffs to kind of take a step back and say, there's something else going on here that we probably need to look at a little bit deeper and see, is this a physician who over the course of their career has trended in a way that their professionalism has been a constant problem and is not something that has improved. So we talked about a lot of these things already. Medical staff bylaws are going to govern that conduct. You're going to be looked at for, are you cooperative or are you disruptive? Do you do things that affects the ability of others to render good quality care? Sometimes, one of the examples would be the nurses that don't call when they should because they have this fear of being yelled at, or they're intimidated by the tone of voice of the physician on the other end. You could be labeled disruptive because of one event or a series of events. I remember early in my practice, one of my first medical staff investigations I was involved in related to a physician that had anger management issues, and he threw a saw in the OR, and it nicked the arm of one of the nurses. Now, she wasn't seriously injured. All she really needed was a Band-Aid, but it was just the idea that somebody lost such complete control that they threw such a dangerous object, and they had no wherewithal to say that what they did was wrong. It was a physician that just wanted to make excuses for what it was that led him to act in that manner, and there was no self-accountability, and that individual was summarily suspended and did not return to that medical staff. So it could be isolated events of unprofessionalism that can be very disruptive to your career, or it could just be a trend of behaviors. I have a list of other sort of disruptive conduct on the slide. I could give you examples of each and every one of these that I've dealt with on medical staff investigations over the last 30 years. One of the more recent ones dealt with sexual comment in the OR, and a surgeon and their certified first assist were having very loud, aggressive behavior about sexual preferences, sexual positioning that each one preferred, and how their spouse or significant other responded. It was very disturbing to a scrub tech that was in the OR, and she filed a complaint on the compliance line. It was investigated and determined that this was just kind of normal conduct for the surgeon and his certified first assist, and nobody really liked it, but nobody ever really complained about it or did anything because they were afraid that he was a very busy surgeon and that the medical staff would just rally around him and that they would then be the subject of retaliation. So everybody had kept quiet. And turned out during this investigation that not only was it the surgeon and the certified first assist, but the manufacturer's rep also was involved in the communication. So at the end of the investigation, the surgeon was summarily suspended for 20 days. The certified first assist was as well. Both were required to attend a course on professional conduct, and the manufacturer's rep was suspended from the hospital campus for the remainder of his career. So sometimes we think that we're just talking to somebody else and we're not really talking to this bigger audience, but what we're talking about is really unprofessional, and it does affect other people. And it certainly impacted his ability to operate for 20 days. So all of these things can be potentially harmful to your reputation, your ability to work well with the people that are part of your patient care team. So we've talked probably, I'm just kind of keeping an eye on my time here. We've talked about a lot of these things already. You know, what is the downside to unprofessionalism? Certainly the National Practitioner Data Bank report, unless you have strictly a clinic practice where you never go in to the hospital, National Practitioner Data Bank reports, unprofessional conduct can affect your ability to stay on staff at a hospital and can affect your ability to get on staff at other hospitals. And certainly when there is a report made, it will make its way to the licensure board and there will be an investigation. If you're not somebody that has the respect of your peers, is known to be unprofessional, it's probably going to impact the number of referrals that you get. You may not have the support of other people on your medical staff. There may be a trend in you having more adverse patient outcomes than others because of that lack of teamwork and that lack of professionalism that leads to an intimidating environment. Loss of your license and therefore loss of your livelihood, which you've invested a great deal of time and money to get to that place. And then the financial losses that go with that, those punitive damages that we've talked about. If you're suspended from being able to see patients in the hospital or take patients to the OR, that will impact you financially. And the trend now is in dealing with physicians who are having issues of professionalism, sending them to anger management coursework, sending them for neuropsychological evaluation and counseling, that those things are required by the medical staff, but they're paid for out of the practitioner's pocket. And some of these courses are $30,000, $40,000 and take 6 to 8 weeks to complete. They're out of state. And they can be very successful. And I've seen physicians go through those programs and return and be very viable members of the medical staff, but certainly at a financial cost to them. So I will end here by saying, you know, the conduct by which you're going to be judged starts now. When you finish your program and you get out into the world of practicing on your own, the only conduct anybody has to look at is your conduct as a resident. And so you want to be that person that your trainers speak highly of as somebody that the team respects, that respects patients, and that meets all of those professional obligations and has good ethical and moral character. And I think that there are a number of physicians that can honestly tell you it truly can be the thing that makes you or breaks you professionally. So hopefully you have taken something positive away today. I always enjoy speaking to this group of people. I really admire you guys and all the hard work that you put in to get to where you are, and we need good physicians. So I thank you for your time.